I feel the easiest way to study the elbow joint is in a lateral view. Now you can see the elbow joint in a semi-flexed position in the upper diagram and in a complete flexion and extension position in the lower diagram. Now let us look at the upper diagram. So you can see the humerus here, and you can humerus proximally and ulna and radius distally. Now for the formation of elbow joint, the modification at the distal end of the humerus is trochlea or a pulley. So towards the ulnar aspect. So ulna will modify to form what is called as a trochlear notch to accommodate the trochlea. Is that clear? Okay. So how does this ulna forms a trochlear notch? That is a question. So this is formed by a coronoid process in front. See, the cursor is on the coronoid process and an olecranon process behind. So this is the olecranon process. So the coronoid process in front and olecranon process behind forms a trochlear notch, which will accommodate the trochlea on the humerus. Okay, so now what happens in this position? Let's see what happens when the elbow is flexed completely. Now elbow has gone to complete flexion. Now the coronoid process is accommodating or lodging in a fossa on the lower end, anterior lower end of the humerus. This fossa is called as the coronoid fossa. And imagine the elbow is going for complete extension. Here, the olecranon process is lodging at a fossa behind the humerus known as the olecranon fossa. So in a nutshell, the fossas are on the humerus. That is the coronoid fossa on the front and olecranon fossa behind. While the processes, that is a coronoid process and olecranon process, are on the ulna. Similarly, at the radial aspect, the humerus modified to form a rounded capitulum, which will be articulating with the head of the radius. So in complete flexion, the head of radius will lodge on a fossa on the lower end of the humerus in front, known as the radial fossa. So this is how the arrangement of bones in the elbow joint happens. Thank you.